Yes, the session was an update on the role of e-health and e-cardiology in cardiovascular prevention and rehabilitation. It's really surprising how much the interest increased in such sessions over the last few years. 5 years ago we have been 12 people in the room, and this time the room was crowded. This shows the increased recognition of the importance of this topic. So we have seen some results of international European multi-center studies in this field. One important issue is how can you use digital health in cardiovascular prevention, in particular to change lifestyle, to improve your lifestyle habits. And there are a lot of tools around. You have these smartwatches, you can use apps, you have websites where you can get information. But the common finding is that in general the patients are interested in that. They use it for a certain time and then they lose interest in that. Maybe this mirrors our hectic time where we are living in now. And the second application is for tele-rehabilitation. So because the problem is that people sometimes have no time, or they are living too far away from rehabilitation programs, and we would still like to include them in the programs, so we could use modern telemedicine technology for surveillance of training. And we have seen some results, so it's very easy, the surveillance of training. But the problem is that it is still an elite of patients, I would say. So the more motivated patients, better educated patients, they like to use these tools, but it remains a problem that people with health illiteracy, low socioeconomic status, they usually don't use this. So this will be a major question for the future. How can we reach out to this population? The most interesting results we have seen from a study for tele-rehabilitation in elderly people with heart failure with preserved ejection fraction. So mostly elderly people, more ladies than men, with stiff ventricles because they had arterial hypertension for many years and other reasons. And it was a big surprise that this population of elderly people really did adhere to this tele-rehabilitation program, that they did the training, they liked the tool. So it's very promising, because we thought until now that it is mainly the younger generation which has interest in these digital health tools. But now we have seen that there is a growing number also of elderly people using this. But at the end, as a conclusion of the session, we find that there is still a lack of evidence for digital health. Many things make sense to use them, but there is the last proof of cost effectiveness also of these interventions. There was one study showing that at least it does not cost more than regular care, because you have costs, you need equipment, you need these smartphones, these tablets, and the communication tools and the cloud for all this information transformation. And so at least it's not more expensive, but we cannot say today that we save money. So in conclusion, we still need a lot more evidence about the effectiveness of these interventions in prevention and rehabilitation, and also in regard to cost effectiveness.